Hello, my future OB nurses. So we're going to continue on the subject of postpartum hemorrhage. Last time we spoke about early postpartum hemorrhage, which happens usually in the first 24 hours after birth, usually after the delivery of the baby and the placenta. So now we're going to focus more on late postpartum hemorrhage. This one usually occurs at the 24th hours and up. So from 24 hours all the way up to 6 weeks postpartum. So we really need to educate our patients on what the signs and symptoms are, what are the possible causes, how to check their fundus, how to check their lochia, if there's any change in their lochia. So let's get right into the content and talk about late postpartum hemorrhage.
Hi guys, welcome back to Flav, the OB instructor. We're going to get right into the subject of late postpartum hemorrhage. So what are some of the learning objectives for this video? Well, we're going to develop an understanding of late postpartum hemorrhage. What are its causes, its risk factors, signs and symptoms, develop a basic understanding of the various treatments for late postpartum hemorrhage, and also we're going to apply some of those NCLEX style questions just to see if you guys remember what it is, okay? All right, so what is late postpartum hemorrhage? Remember we said that anytime a patient bleeds after the delivery of the placenta and up the way up to 24 hours, we call that early postpartum hemorrhage. So late postpartum hemorrhage is defined as hemorrhage that occurs after the 24th hour after the delivery of the placenta, and it can occur all the way up to 6 weeks postpartum. Usually occurs after mom goes home. So what does this tell you? That we need to educate our moms, our patients, right? Before they go home, tell them how to assess their fundus, where it should be, what their lochia should look like, right? What color it should be, and what odor it should have, and the amount of lochia they should have. And if anything is out of the norm, they really need to go back and see their practitioner. So we already spoke about the causes of postpartum hemorrhage, right? We spoke about the 4 T's. We spoke about tone, trauma, tissue, and thrombin. So let's see what are some examples of these. And these usually occur in the first 24 hours. So uterine atony, usually in the first 24 hours, that's when it occurs. A hematoma, again, first 24 hours usually starts to develop. Now, tissue, of course, has to do with late postpartum hemorrhage, and that usually occurs after the 24th hour after the delivery of the placenta. And thrombin, we're going to go a little bit more in depth into another video about that, but usually that has to do with coagulation problems that you can see within the first 24 hours, but sometimes you see it after that as well. All right, so late postpartum hemorrhage, what are its major signs and symptoms? Okay, so it's called late postpartum hemorrhage or secondary postpartum hemorrhage, and it usually has to do, a major sign of it is subinvolution of the uterus. What does that mean? Subinvolution means that the uterus is not going back down to its pre-pregnant state the way it should be. Remember we said it should be 1 finger breadth a day or 1 centimeter a day. So if your patient started off after the delivery of the placenta being at the umbilicus and firm, right, her fundus, then the next day she should be U-1, meaning that the uterus is 1 centimeter below the umbilicus. Then on the second day she should be U-2, 2 centimeters below. Well, with subinvolution, the patient's uterus keeps on staying up or it goes a little bit above the umbilicus. Not a good sign. So what does this mean? That she may have placental tissue fragments that are still in that uterus, or she may have an infection. Now, some of the things that the doctors will do, and you will wear, sterile gloves in doing this, but sometimes the practitioner has to put their hands all the way up inside that uterus and really scrape off all of the placental fragments that were left in. Really painful for mom, so please try to medicate her before the practitioner does so. So what are some of the signs and symptoms of late postpartum hemorrhage? Well, again, we spoke about some of them. So if it's a retained placental fragment, then of course, the fundus is going to be higher than expected. Okay, the uterus is going to be soft, prolonged lochia, and of course her lochia is rubra on the 2nd week or the 3rd week or the 4th week. It's still rubra. Well, it should make the progression of going from lochia rubra to serosa to alba. Another one is infection, right? So one of the telltale signs is a foul smelling lochia, or she may have a fever, or she tells you, oh, I just don't feel good, right? She has malaise, a lot of backache, and a lot of pressure down there. So right above the symphysis pubis, sometimes you touch it and they flinch, right? So pain, tenderness, and pressure down in the pelvic area is very common. What are some of the risk factors of late postpartum hemorrhage? Well, the practitioner attempted to deliver the placenta before it was ready and kind of snapped it off, and just part of the placenta came out and not the whole thing. Manual removal of the placenta, a placenta accreta, that's when the placenta embedded not only into the endometrium, but actually went all the way to the muscle. And so that can cause some of the placental fragments to stay inside of the uterus. Previous cesarean birth, and fibroids, same thing. You've got abnormal tissue where the placenta embedded, and once the placenta is detached, some of that tissue remains inside of that fibroid. What are some of the treatments for late postpartum hemorrhage? Well, of course, we're going to give oxytocin, methogen, hemobate, antibiotics if she has an infection. And usually the doctor does an ultrasound before to see if it's retained placental fragment. And then they will either try to manually remove it, or they'll do what we call a dilation and curettage. Okay? And the dilation and curettage is pretty painful, guys. Again, try to medicate the patient before doing this procedure. So what are some of the nursing considerations? Well, we want to educate our patient on how to identify the signs and symptoms of late postpartum hemorrhage. For example, again, where is your fundus, mama? How should it feel? It should feel as hard as your forehead. And if it's weakened body, you need to massage it. If you're still having a lot of bleeding, you need to tell your practitioner. Or if the bleeding is not changing color, it's still red, when it should be a brownish red or a pinkish. Okay. Identify abnormal changes with the lochia. Remember, rubra to serosa to alba. Identify the amount and the odor. So lochia should go progressively down. So many of, she had moderate bleeding right after the delivery. By the time they're recovered, usually they have scant to small bleeding. By the time they go to postpartum, their bleeding should really be scant. Scant, small. The odor of the lochia should be earthy. But if it's foul smelling, then they definitely need to let the practitioner know, because they might have an infection. So educating our patient is key to preventing them from having late postpartum hemorrhage. Thrombin. What is thrombin? We're going to talk about that in a later video, but it's bleeding caused by coagulation problems. For example, if you had a patient who had preeclampsia, and the patient goes into HELP syndrome and then to DIC, usually they go hand in hand, and we try to prevent that by, not letting the blood pressure go crazy, because we don't want liver involvement. So I'll have another video on that eventually in the future, so please look out for that one. So let's test your knowledge. So the first one says, a patient calls the OB clinic and states that she has a baby a month ago and is having a lot of backache, feels tired all the time, and she continues to saturate 6 pads a day with brownish, reddish lochia that smells bad. When asked if she can feel the top of her uterus, she tells you, it's kind of hard and just above my pelvic bone. What should you do? Take a second, guys, pause the video, and let me know which answer you choose. All right, let's see what you guys put. All right, so if your answer was number 2, you got it right. Encourage the patient to come to the clinic tomorrow, because she has products of conception inside of her, and they need to be removed. So I would say, actually, Mama, you need to go to the doctor now, and if your practitioner is not open right now, you need to go to the emergency room. That's what I would encourage. Now, some patient will tell you, well, I have the baby, my family, I can't. Well, first thing tomorrow morning, you need to go to your practitioner, okay? Because this is important. We don't want her bleeding. The next one says, predisposing factors of having retained placental fragments are, and you're going to select all that apply. So again, pause the video, take a second, which answers are correct. You said previous cesarean section, placenta accreta, uterine fibroids, and manual removal of the placenta. You got it right. So previous vaginal delivery? No, it's not an indicator of late postpartum hemorrhage. All right, the next one. Oh, I kind of gave you the answer too fast here. Sorry about that, guys. But let's read it anyway. It says, you are assessing a patient who is having 2.5 weeks of postpartum in the clinic, and you palpate her fundus just midway between the umbilicus and the symphysis pubis. What should you do? Well, you should ask her about her lochia, the color, the amount, and relay these assessment findings to the doctor, okay? Because after about 2 weeks, you really should not fill the fundus between the symphysis pubis and the umbilicus. It should really be inside the two pelvis. So late postpartum hemorrhage is usually related to what part of the four T's? Late postpartum hemorrhage. Oh, yep, has to do with the tissue, right? Retained placental fragments that stayed inside of the mom and can cause an infection. You don't want that. Or false. A patient with preeclampsia may develop health syndrome, which leads to DIC. Okay, which can lead to DIC. These can manifest themselves as early or late postpartum hemorrhage. What do you guys think? True or false? All right, it is true. Then again, I'll have another video on that one, so stay tuned. That's it for now, guys. So please do not forget to like, subscribe, share, comment, and press that notification bell, because then when I have new videos coming out, you guys will be able to listen to it. It was a pleasure as always. Until next time, Flav, the OB instructor. Take care, guys.